Thank you, Nicole. Testing just one of the areas of concern when it comes to this public health emergency. So what else is the state doing to respond? Joining us now is Major General McGuire. He's the Adjutant General for Arizona and Director of the Arizona Department of Emergency and Military Affairs. General, you've said the National Guard is involved in 3 targeted areas here: food supply, aviation, and now a medical group. How successful, especially with that food supply and aviation, has that been in the Navajo Nation, which has been one of the areas of focus?
So thanks for having me, Steve, and I appreciate you giving me the opportunity to talk about what we do here in the Division of Emergency Management and as a supporting group, the National Guard, up on the nation. As you mentioned, I've touted this a number of times in press conferences. We task organized into 3 primary task force logistics, task force aviation, and task force med. The medical piece being that group that's been helping surge testing. We did some of that up on the Navajo Nation. In terms of the logistics piece, just this week we were able to enter into an agreement with the New Mexico National Guard and coordinate with the Navajo Nation leadership to help continue to expand delivery of food supplies and other things that have been much needed. And Task Force Aviation up on the nation was actually the first group to triage the outbreak back at the end of March in Tuba City, just using our aviation resources to get up there with Black Hawk helicopters. In terms of success level, I think it's been very successful, the partnership. I'm encouraged that the Navajo Nation government plans to reconvene on the 5th of July. We continue to support them, and we've seen flattening to decreasing number of cases over the last couple of weeks, and we're very happy with all the assistance we've gotten from all the federal, state, and local partners as we work with the tribe on a whole community response.
General, can you talk a little bit about this medical group task force? The governor calling up an additional 300 Guard members to help in contact tracing. How many have been deployed so far? Because you still got to train people, you still got to get people up to speed on this particular task. What's the timeline on that?
Right, so we have right now about 725 on mission. We plan to bring in up to 850 by the end of the week. The medical task force is relatively small. Here in Arizona, we don't have a huge medical staffing component that we can deploy forward. We have 2 medical groups in the Air Guard and a medical readiness unit in the Army Guard. All in might be 200 of the nearly 8,000 guardsmen. What they do is they provide all the things we need to sustain our own force, as well as provide, like I said, that triaging. So what we're going to do is we're going to work with the Department of Health Services. We're going to organize to be in support of all 15 county health directors who have the task of doing this contact tracing. They have case investigation managers in each county, and they will then be allocated a certain number of our guardsmen that were going through training yesterday. They started on Friday, today, and tomorrow. The first 40 will be on mission on Wednesday. We hope to get all 300 of them out by next Monday as we get them through that training. And that training really involves them having case managers' direct contact lists from those that have tested positive, for us to reach out to them, contact them by phone, talk to them about monitoring their systems, talk to them about precautions, talk to them about avoiding those at risk in the community as they have not yet been tested or could be asymptomatic and positive.
General McGuire, we wish you and all the guardsmen out there on duty the best of luck and the best efforts as well. Thanks so much for joining us today.